Recording in progress. Marvelous. Right. So I'm going to talk about preparing for the FRCS, but as I've said, it also will touch on how to maximize your rotations. And it's basically a massive resource of all the possible things that you could potentially use for your rotations and also for your FRCS. Let's just get rid of people there. That's it. Right. Let's see if this works. So I'm going to talk a little bit about the structure of the day. If I can get onto a slide. Hang on a second. There we go. I'm going to talk about the structure of the exam, both the section 1 and 2, how to prepare for each section, although there's a lot of crossover. And in a way, when you're starting to think about going for the exam, it's almost like you're training for sort of a marathon, but you're going to be doing a race 10K before that. So you need to think about, utilizing things that are going to be useful for both of the exams, but altering how you do that for the sort of different sections. And then it's just resources. And this is just resources for everything that you could possibly need or think about for your exams. And because it's everything that everyone has used in the last 2 years in the region, don't get panicked to think, oh my God, I've got to use all of this. This is what's out there on every level. And then you pick what you want to use. So general info. So when you're starting to think about sitting it, you need to be familiar with the JCI website. This is where you apply for the exam. You apply for the exam in its entirety, so for FRCS, and you pay for it in its entirety as well up front, which is close to £2,000. And you then select dates for sitting for the exam for section 1 and then for section 2. The section 1 part of the FRCS is all written, or I say written, it's all computer in a DVLA computer. So you're sort of sat next to 17-year-old spotty people taking their theory test, which is slightly unnerving. But you have 2 papers for that, 120 questions per paper, morning and afternoon. You get about 2 hours, 15 minutes to sit that. And they're all SBAs, which is single best answers. And you're saying, oh, what are they like, Alex? Well, the good news is this afternoon you will find out, because we're going to do a little mock FRCS and how you approach SBA answering. Because actually, for most of us, we won't have sat a written paper for a long time. It won't be since MRCS Part A. So it's quite an unusual sort of feeling for us. Whereas the section 2 exam, which is the clinical and viva aspect, although is a more intensive, immersive sort of 2 days of exams, it's actually something we're a bit more familiar with because it's talking to patients, it's talking to consultants and going through patient management. You can apply for the exam once you've got an SD6 ARCP outcome 1. So for most of us, that is in the May. So that means that you can't even apply for the exam until you've got that kind of tick off the box. So really you're looking at in your SD7 year, or what is now going to be phase 3, that you can start to sit the exam. And that's relevant to know because you need to think that you're going to be on track to get an outcome 1. What's very frustrating is if you think that you're going to sit the exam and actually you fail to finish off that paper and submit it, and therefore you don't get your outcome 1 SD6, you're then held back from the exam, which can be a bit frustrating if that's how you sort of plan things. You also need to know what flavour you are in terms of your specialty, and you do that up front. So you have to let them know so that they can put you into the right category for the section 2 exam. And then the application form is not difficult, but it's slightly laborious, and you need 3 references for it. And Caroline will not want to be doing your reference the day before the deadline of the exam. So make sure that you're prepped for that. You also need to just upload a CV and summary of your logbook, which is relatively straightforward. You also need the cash as well, which is, a lot of money to put up front. And then all being well, if you could pass it and just go straight through it, you don't need to have any additional costs. But if you do fail, then you do need to then give them additional money before you can sit the section 2. So how do you prepare for the FRCS? This is kind of like $1 million question, isn't it? And I think how we've always done that historically is we've asked other people, like, what did you do? How's it worked? And so on. Well, I would actually say the first thing you need to do is pour yourself a drink. It could be a cup of tea, or in my preference would be a glass of wine. And the first thing you need to ask yourself is, how much do I know? And you have to be really, really brutally honest with yourself. Are you sitting in MDT thinking, I don't know what neoadjuvant means? Are you sitting on a ward round thinking, I'm not, I don't understand the decision making about this, complex aspect. I'm sitting in clinic and I don't really understand these bits and pieces. Or are you sitting there and thinking, actually, yeah, my baseline knowledge isn't too bad and I've got a fair amount, I should be okay? Because that's going to set the tone for when you need to start thinking about doing your preparation. Then you pour your second glass of wine and you think, right, what type of learner am I? Some of us will work really well as a group, we'll like to buddy up, we'll like to talk through exams and questions. Some of us will want to spend 12 months beforehand reading every book and writing color-coded flashcards. You're all adult learners now, you're all brilliant at exams because you've been doing them for years. But you have to really think about what learner am I and what's going to really make me get up to speed with the syllabus, and you utilize the resources appropriately for that. And then you're pouring your third glass of wine, you're a bit pissed by this point, and then you think, like, what other shit have I got going on in my life? Because you sit the exam at a personally quite tough time. You're a bit older, there's other stuff going on. You've got lots going on in your career. You're trying to make yourself, ready for kind of final year training. You're trying to finish off that paper that's been resubmitted and rejected lots of times. You might have a partner. You might have a dog, ducklings, children, whatever it is. There's always going to be more stuff going on than there was for your MRCS, where most of us sat it when we were in core training, and it was the biggest thing that's going on in our life and nothing else. The FRCS is a total different aspect. And also work is really hard, isn't it? Like, it's knackering. You have a lot more responsibility when you're into SD6 and 7, and you have to feel like you've got your A game at work and then you're coming home and revising. So what I would say is get your house in order before you start thinking about the exam. So get rid of all of the other stuff that's going on. I mean, I don't mean the kids and the ducklings and the dog, you're gonna have to keep those. But I mean, finish off that order and just park it, put it to the side, get rid of it, finish it, because you will not be able to do all of that stuff whilst you've got the exam. It must take focus. So on that note, I'm now going to talk really about resources. And this is the ding, 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 ding. This is irrelevant for anyone that's going on your placement, because actually you can utilize some of these resources for when you're rotating through. Even if you're ST3 and you're thinking, oh, the exam's so far away from me now, I don't need to worry about it. But actually, you're going to be rotating through placements that you might never come back to again before your exam, Sam's sitting here with me and we do breast together up in Cheltenham, and he probably won't do breast ever again. So he's really got to make the most of that placement. I mean, he's loving life and enjoying every day, I know that, but he's really got to get everything really that he wants for the exam for breast, which thankfully actually isn't that much, but you get my point. I remember doing my last colorectal placement before going to the exam and thinking, right, I've got to get this nailed now because I won't be coming back to it really. So we're going to look at all the different resources that are available. And as we've said, this is all going to be on our website, so you can come back to it at any point. I've gathered these resources from talking to all of the trainees in the last 2 years who've been successful in the FRCS. So this is what everyone has possibly used, and I've got a bit of a background on what was good, what was bad, and then you can pick from that. So the first thing is you must look up your syllabus, whatever you're doing. This is, what you should be really kind of looking at in terms of when you're setting up your learning agreements for your placements as well. It puts it in, absolute order, all the things that you should be knowing for that part of the curriculum. So not only is that a really easy way to set up in your learning agreements by saying, right, I'm on, colorectal, I need to know about, well, I've got an example, pilonidal disease, et cetera, I want to be able to get through this and see these patients in clinic. It even tells you what to do from a technical aspect. So you can just incorporate that into your learning agreement by saying, well, by the end of this placement, I want to be, competent in right-sided colectomies. I want to be able to get 20, etc. So always look at your syllabus, but particularly when you're prepping for the exam, it's useful to see it because there's a couple of funny topics that are in there that come up in the exam. So particularly things like skin, urology, a little bit of gynae, things that we sort of cross-cover on our different pathways, but unless you've done a job in it, you might not have come across it. And then the second thing, if specific for the exam, is look on JCI website because they also have a blueprint of the syllabus. And at the moment, this hasn't changed, although it probably will to a certain extent. But what they provide with you is a list of all the conditions. And then there's a tick box of this will be assessed in section 1 and this will be assessed in section 2. So look, when you're prepping for section 1, look at what's in the tick box and then park anything else that's out with it. And for the section 2, you can do the same. Books, right. So for some of you, you'll want to do a lot of book work prior to the exam. Even if you're not sitting the exam, I'd recommend that you buy and read and digest this book. This is one of our core texts, the companion series for general and emergency surgery. It's really well written. It's really easy to read. It covers all of the emergency general surgical topics. And for the exam, you certainly need to know this kind of front to back. But it's a really good book to have when you're doing your on-calls anyway. So I'd recommend you get this. The companion series then also has all of their subspecialties. So again, if you're someone who wants to do a lot of book work before the exam, you think, actually, do you know what, my knowledge isn't great. I want to do lots of, color-coded flashcards or whatever it is that works for you, then these are the companion series within that. But for most people, the emergency book and then your individual specialty would be enough. Certainly for the section 2, the book is at a level that would be expected that you should be able to sort of regurgitate it for section 2. So particularly for the breast, for instance, that was my kind of my daily read on the run up for the exam. All of these books are available through HE funding through the individual libraries. So what I used to do was I would just pick a topic or a chapter. So for instance, there's a really good chapter in the HPB one about pancreatitis and complex EBD stones and management of that. So that was enough for me because that was a bit in that gap of the knowledge that I didn't know, whereas I didn't need to get the whole book. So what I would say is just be selective about the bits that you need to fill in based on what you know. Trauma and critical care. So for the exam, straightforward, you need to know ATLS, you need to know CRISP. There are some surgical critical care Viva books, which are quite good. They sort of focus a bit more on the weird and wonderful, ITU physiology that we haven't learned for ages. And then Top Knife is a really good trauma book. I would really recommend buying Top Knife just to read. It's like hilariously written. It has lines which say things like, all a good trauma surgeon needs is an educated digit, or, all you need is a knife and a strong heart, and this sort of thing. It's really amazingly written and it's worth a good read. So I've enjoyed that. It does make you want to be a trauma surgeon, but breast and trauma don't go so well together. So I've had to part that. Is someone chatting to me? Hang on. Thanks. Clinical key for free. Thanks, that's great. Where do we get up to? Let's have a look. Other textbooks. Operative textbooks. So again, this is useful, for your placements, but they're handy for the exam as well, because, you do need to be up to date with the idea of, how a trauma laparotomy works, blah, 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 if you've come out of that for a while. So the Kirk's General Surgical Operation book I found really useful during my training, I think because it's got lots of pictures in it and sort of says things like cut here, which is really helpful. And then there's a really useful book, which is the Anatomy of General Surgical Operations. So it breaks down all the individual, resections, etc., and talks about the pertinent anatomy. And again, is much more of a kind of roadmap for that, which is, again, quite useful. And again, it's once you've had, after your, what was it, the first glass of wine, wasn't it? Like, how much do I know? If your anatomy is not great, then these are the sort of things to utilize. If it is good, you don't need to use it. And then there's academic textbooks. And again, this is more for the section 2, but really we should be keeping up to date with all of our kind of academic training. So make sure that your GCP online training is up to date. But again, when you start preparing for the FRCS, you do need to do a little bit of work for the academia. And certainly there is an academic station in section 2. So again, it goes back to how much do you know? If you don't know very much, then you might want to start off with something basic like how to read papers and working your way through that. The one book that I would recommend for pushing yourself from an academic perspective is Landmark Papers in General Surgery. So although slightly archaic, what this book's really good for is giving you the background evidence for your specialty. So again, you don't need to read this cover to cover. You just need to be selective for the bits that you need. So I read the chapter for breast surgery, and that gives you the background on, you know, the evidence behind breast conserving surgery, axilla, and so on. So it just kind of preps you a little bit more from that perspective. And then there are some specific FRCS textbooks to use. So when we think about section 1, which is question-based, there are some question books. And this is probably the better of the 3 that are available. So this one, although is still slightly out of date because it includes SBA, single best answers, and EMI, extended matching index, the exam now is just SBAs. So these are good, but recognize that they're actually more of a revision tool rather than they're not past papers. They're a way for you to kind of work your way through the curriculum and the syllabus. This one is also available. It's all right. It's not as good. But again, if you're someone who likes books and wants to do question banks in the book, then that's another volume for you to utilize. And then for the section 2, there are 2 books that are available. Again, this one, Cracking book, is, I would say, the better of the 2, but also the companion cases. And these work through the Viva aspect of the section 2. But what I would say about this is that they take you from start to finish of a patient journey. And when we talk about the exam in a little bit, it's a little bit more faster paced than that. But these books are really useful anyway to have. They talk about, you know, all of the kind of core, you know, critical conditions that we see, and talk you through from very basic kind of history examination investigations on to then leading into the evidence of, you know, the practice that we do. So really, why not look at these books early on in your training? You know, we don't have to wait until we're sort of sitting the FRCS to have a look at them. So I would start to utilize those a bit earlier, to be honest. And although the bottom 2, the sort of 2 books on the right, are specifically for section 2, there's actually a lot in there that's really useful. So it might be that for section 1, you want to get these books early rather than later, so that you've got them as well with you. And then we move on to question bank. So this is sort of specific for section 1, really. So for section 1, however you want to learn is one aspect of it. You know, how are you going to get your knowledge kind of fully utilized? But then you do need to practice questions, because as we've said, you're doing 240 questions over 4.5 hours. So that time pressure is there, and that there is still a performance in doing the exam. And some of us are better at written exams than others. Like some of us will find more of a strength in a clinical exam. So you definitely do need to do some question banks. Now, we've said that there are some books available for that, but there are also 6 available websites that have a question bank. These are all the pretty pictures of them, and this is a review of them all. So in no particular order, I've put obviously links to them, and also kind of costs over the course of the time, and then what their volume bank is like, and then some positives about them. When I spoke to all the trainees that had passed, everyone had used a few of these, of different ones, so it was quite useful to get a rough sort of idea. So EFRCS is the main one that we go to, and that's because it's really well set up. It's run by a surgeon in the Southwest who was a gold medal winner, so it's got a real insight into kind of, you know, what the exam should be tailored towards. It's got a huge question volume bank, and what's really good about it is it's got really good kind of blurb for after it. So after the question, it's got really almost like a textbook, so you can really revise from the question bank as well as practicing questions. But they're not all SBAs, they're a bit of a mix, and some of them are sort of, you know, multiple choice questions and things like that. So again, although it's good for revision, I would say it's probably not the best for your kind of practicing your FRCS performance, because it's not as similar to it. But I know that Ed is going to be changing some of that. The next one is FRCS Companion, which I would say is really useful to use in adjunct with EFRCS, because these are all SBAs, and they've started to bring in imaging as well, which is really handy. So in the section 1, you will get some CT imaging, some ultrasound imaging, be asked to comment on it. And so I think it's just useful practicing that. The next one, I haven't come across anyone that's used it, so that's why I've just had to put no comment. But again, you know, cost wise, it's equitable to the others. It's a smaller question bank, so I think it's the sort of thing where if you've gone through lots of question banks already and you want more, then that's a good way to volume. On examination, I couldn't even be bothered to find a neutral face emoji. I just wrote the words. It's on examination, so it's not aimed at surgeons, really. And I think where it lets itself down is it just utilises even the MRCS questions. So you might be there and you suddenly get asked about, the musculocutaneous nerve, whatever, and you just think, well, this is really irrelevant to me. So again, I would say if you're smashing through the questions and you just want volume of just anything, then this is not a bad one to pick because it's got a high volume bank. But yeah, I think that says it all really. And then the next three are quite similar in themselves. The next two, so doctors' exams and higher FRCS, again, they have a good kind of SBA mix, good volume of question bank, relatively new. So sort of up to date with the new format of the exam. So again, a different one to utilise, and all of them have demos. So what I would do is just go on to them, pick a demo and make a decision. But you can see that they're all time pressured. So what I would do is when you're thinking about the exam, look at, am I going to do 6 months? Am I going to do 3 months? How are you going to set this up for yourself? And then the FRCS 5 website at the bottom there is definitely more section 2 because they go through scenarios. So again, if you would rather do something online than in the book, this is another way for you to utilise it. I'm sure in the years to come, there'll be more resources available, but at the moment, going to press, this is what's out there for you. Then you need to know some guidelines, not just these three. These are just the ones I've picked. And I put the ABS one on there because it's like so unwordy with just pictures. I was like, that says a lot, doesn't it? But you need to look at guidelines. And really, you should probably be looking at these anyway, shouldn't we? If we're managing patients with small bowel obstruction on the tape, we should really know about the Bologna guidelines, shouldn't we? Seeing as that's what we make our evidence base for. Same with Atlanta classification and management of pancreatitis. Really, when you're on your placements now, gearing up towards the exam, you need to be proper toddler at work, don't you? You need to just be saying why? Why? We're using this, why? We're doing this, why? If you don't know the answer, go and find it, but ask your consultants, ask other registrars, and have that inquisitive hat on so that you're getting there. Now, you're then going to say to me, but Alex, where do I find all these guidelines? Well, good news, everyone. We have now got a regional kind of pot of internet space. I think it's quite a small space, but it's up there next to Elon Musk. And the SharePoint access is basically somewhere that we can put any resources that we need to. And it's there. There's a couple of things we need to finalize to set up, but we have all of the most relevant guidelines, I would say, for all the different specialties. And again, this is combined from all the people who've done their exams in the last year or two. So we've got the ones that the sort of seminal landmark papers for upper GI, colorectal, breast, etc. So they will be there. And obviously, if you come across some that you think need to be added, then this is what that SharePoint is for. It's to share it all. Of course, you can go out and find it all yourself, and it doesn't take long with your pal, Dr. Google, but equally, we're all doing the same thing. Let's not repeat ourselves. If I get a chance later today, I'll show you where that is on the... No, sorry, general surgery. That's okay. And then there's podcasts as well. So again, this is good for your FRCS revision, but actually these are really good for your placements. There are 3 that are useful. The first 2 are the best. Behind the Knife, which is Jason and Kevin, who really became strong friends of mine during my exam prep. I missed them actually. But these guys are some American surgeons who set this up for their, ABSITE equivalent of the FRCS. They're really good. They're really interesting, engaging. They're about 45 minutes, perfect commute time. Utilize these for during your placements. If you're doing a colorectal job and you're driving to Swindon, then listen to something on rectal cancers on the way or something if you can bear to do that in the morning. Bear in mind it is American, so there is a slight difference in some of the guidelines and management, but otherwise they will become firm friends and you will miss them. Behind the Knife has over, I think, 500 episodes now. So you need to be a little bit selective in what you pick. So again, what I would say is when you're, thinking, what type of learner am I? How am I going to prepare for this? Pick the ones that are going to be relevant to you. Otherwise, it's almost too much choice. First Incision is brilliant, and this is the Australian version of it, and it's a girl called Nicola. I feel like she's a hottie. I haven't seen her. I haven't Googled her. I don't want to be disappointed, but she's Antipodean. She's got a really great way of presenting. It's really straightforward. It's a little bit more kind of basic in a way than Behind the Knife, but it's actually really easy to listen to. And again, she did some ones on the breast surgery, and they're probably a little bit below what you would need if you were a breast subspecialty just sitting the section 2. But, Sam, they'll do for you, mate. They were great. So listen to those on the way to work whilst you're doing your breast placement, and you'll know all the reasons behind, why we do different adjuvant chemotherapy regimes for triple negative breast cancers, pregnancy-associated breast cancers, etc. So those two are really good, and I definitely utilise those both in your rotations and also in your exam. School of Surgery is another podcast that has a good statistics podcast episode, and this is quite well done for talking about why you would pick different statistical methods, how they work and how you interpret them. And that was quite useful in prep for the section 2, because it was a way of being able to not sound like a total idiot when you're talking about kind of statistical methods and methodology and what you would use and why, because that is, if you're not familiar with that, that can be quite a kind of unnerving thing to do. So there we go, another way for you to revise. And then the final one of visual audio is YouTube. So again, I don't need to tell you what to look for on YouTube, but these are really useful for getting up to date with some stuff for section 1. Armando Hasadungan is an amazing Australian surgeon who should have been an artist and has this amazing way of kind of like teaching basic science through drawing. So if you're someone who really engages in that type of learning, then this is a great one to look at. So he would go through, say, respiratory physiology and draw it and talk about it at the time. So a really useful way to adjunct something, because I don't know about any of you guys, but trying to read a book about respiratory physiology is dull. I want to see, we're all surgeons, we want something a little bit more exciting, don't we? And he's got a really good way of doing that. And then Behind the Knife, my friends Jason and Kevin also are on YouTube, and they've got some good ones where they go through imaging, because in both parts of the exam there is imaging to look at, particularly CTs. For some reason, they absolutely love liver lesions. I mean, I don't know why we've got to know between hemangiomas and focal nodular hyperplasia, but for some reason we do. And so this is really good for kind of picking up that kind of side of it. And then there are courses. So, are you a courses person? And again, you just have to decide if this is for you, and also if you've got the cash and the time for it, because it is an expense. There are 4 courses available in the UK for FRCS preparation. Doctors Academy is a really kind of good company that sets up both section 1 and 2, and they're all online now, which is a little bit easier and makes them a little bit more affordable. The section 1 course was over 2 days and talks through a lecture and then mock SBAs for each of the different specialties. So I think some people found that really useful as a way of kind of maybe starting preparation for section 1. The section 2 course, no one's been on that from this region, so I can't really comment on it, but it's in April. It's not very expensive, so it probably is not a bad way to start some prep for it, but you're not going to be getting that sort of face-to-face Viva practice that you probably really need. The Whips Cross course in London usually runs every May, sometimes has 2 sittings of the year. It's a lot of cash, but it is intensive all day, like 8 till 6, 7 days worth of just a lecture followed by Viva, followed by lecture, followed by Viva. So people who sit this find that they are, completely immersed in it and ready for the section 2, but you do have to have a really pretty solid knowledge base before going, because you're not going to learn on that course, you're going to be practicing on that course. And also it's a lot of money, so you've really got to make the most of it. The Alpine course used to be in the Alps. Unfortunately, it's now on Zoom. So the next sitting is in January. This one again is similar to Whips Cross in that it's kind of lectures and Viva practice, and you kind of rotate through. So again, it's a good immersive course for that. And then the Phoenix course have variable dates. You just sort of have to email them and they'll set it up. It's a little bit, it's slightly rough around the edges, but it's a weekend, it's 2 days, and it's just Viva practice and nothing else. So it's quite good kind of on the run up to the exam for you to just get that kind of solid input for practicing. And then there's loads and loads of online webinars. I mean, we're all webinared out, aren't we, at the moment? But, you know, it is a way to just do something other than reading or something other than question bank. So ASGBI obviously has really great ones. You know, once you're members with them, you can go back through their backlogs. They've got some on like, you know, emergency surgical bleeding and that sort of thing, which are really brilliant. Royal Society of Medicine often have some really good ones because it's the Royal Society of Medicine. It encompasses all of the surgical and medical specialties. So you might get one that's, say, on chemotherapy agents. It's quite useful to then have something about, you know, understanding how chemotherapy agents works, etc. And then the trainee committees all seem to have their individual ones. I know Duke's Club is really good for doing the weekends and the Viva weekends. Mammary Fold does regular webinars, but hasn't done anything face-to-face. And the RU group has got a really strong exam prep going on at the moment. It's been really impressive. And then the SharePoint, whoop, whoop, put that at the end. And as I said, that should hopefully be under the care of the new training committee, and they will get that up and running. But the guidelines are all there for you to utilise. Right, I'm going to pause there before going on to section 2 in more detail because we're doing fine for time. So is there anyone in the chat that has got any questions so far about dominating the day with Jason and Kevin, or any questions about exam or placements, utilising placements? Anything from the room? No, shaking the heads. Anyone from the on the calls? Let me just see, nothing in the chat. Shout out if you've come across something different as well that you want to share with us. Right, let's just...
Alex, can I ask a question?
Yes, please.
Sorry. Are you allowed study leave for revision?
You are allowed study leave for the section 2. I'm going to pass on saying how long it is. It might be only a week, but you should be entitled to some personal or private study leave.
You're allowed, so it's Tom. I've spoke to my trust and you are allowed 5 days per exam, as long as it's within your 30 days study leave.
Okay.
Of personal revision. That's on the Peninsula Deanery website.
And Tom, is that for all exams or is it just section 2? I have a funny feeling there was a clause about...
No, there's no, well, I don't know. There's been no, I couldn't read it. I couldn't see any clause about it being for any particular exam. It's just per exam.
Fine.
It's the same guidance as for like GPs and psychiatry and stuff. And they're all much more, I mean, they have like loads of money and so they're much more liberal with their study leave stuff. So it's the same rules and they're much kinder to them than us, I think. So yeah, it's 5 days per exam.
Thanks, Tom.
Thanks, that's really helpful.
And also there was an email yesterday I wanted to ask about, because it very explicitly says we should be able to get one exam course funded.
Yes, it seems to change all the time, doesn't it? So I would say put it in, and sometimes you might find that individual trusts are slightly different. So definitely put them in, but there's no guarantee, I would say.
That shouldn't be trust specific though, because it's funded by HE, it's centrally funded, and there's the email from, it was like yesterday, saying you're allowed, unless the deanery can say they provide a study course themselves. So for instance, in psychiatry, they do like I think like a week-long course which they provide for their trainees. So that is a demonstrable thing that they provide for their trainees as a specific study course. So they couldn't claim for one, but for us, I don't think they could say that they give us a revision course. I mean, there's these 3 training days in a year, but I don't think you can count that as a revision course, in which case we should be able to apply for it. But whether that actually happens or not, yeah, I agree, but it's there in the email, I think was yesterday or the day before.
Okay, thanks, Tom. That's great. We'll update that by the end of the day. But you raise a good point about, Ella, that you will need some time before the exam. I definitely would say if you can swap your on-calls around as well. You definitely don't want to be, finishing nights just before it and that sort of thing, and if you can get some time off around it, because it is a performance, both the section 1 and the 2. So, you need to be well rested. You need to kind of not be knackered from an on-call and absolutely broken, but it is hard to add that in, and that's why the planning is paramount. I guess if you're going to be funded for one course, then pick maybe an expensive one. But anyway, right, we're going to focus. Yeah.
When you practice for section, do you practice it, or did you mainly do it through?
Yeah, for section 2. Yeah, I'm going to talk about that now. That's we're going to just talk about section 2 in a little bit more detail, because this is slightly different in terms of how you start prepping for it. So revision tools, as we've said, are kind of all as above, really. You've got lots of different ways to get the knowledge. When you get to section 2, you have the knowledge to pass this exam because you've done the section 1, haven't you? So this now is about the performance of doing a clinical and Viva exam. And that's where it differs slightly, because you focus so much on a sort of written up until this point, whereas the Viva is different. So now what you really need to do is start utilising everyone around you who's going to give you some Viva practice. So friends, other registrars. I had a little study group. There were 3 of us. The banter level was high. And that's what kind of gets you through it, because, you're practicing on a Friday evening or whatever. You want to be with a group of people that, you're going shoulder to shoulder with, and would sort of die on the sword for. I'm not sure if I'd die on the sword for Sam and Mark, but I would definitely go to the pub with them. But they're who get you through it, and also they're the people who you're going to be sitting there at the exam with on the day. So you want someone who you can go to the pub with afterwards, don't you? Utilise other consultants. Whore yourself out around the region. Pick consultants who are nice, but also pick consultants who perhaps are a little bit more pushing and might make you feel a little bit more uncomfortable, because in the Viva, you're not going to have someone who's really nice saying, "Oh, that's really well done." It's professional exams. So you want someone who's going to make you feel a little bit stressed and uncomfortable. And also go out and see some other specialties, Viva practice with radiologists, go through some imaging so that you can talk about CT, triple phases, etc., that you can sound like you know what you're talking about. Other specialties that are really useful, obviously radiology, but oncology, gynecology, whatever's going to interface with your specialty is really useful to have a chat with. I'm just going to close the blind. Hold on a second. Let me get this now. Thanks. Letting out the winter sun. It's amazing, isn't it? But it definitely is performance, and you start to, although you've got the knowledge, what you're having to do is really come across like you've got that higher order, higher level thinking that would be, ready for you to be a day 1 consultant. And a lot of that is just purely practice. Even if the first question I had on my trauma station was, you're called to A&E to see a trauma patient. How do you assess them? Well, it's obvious it's A to E, isn't it? But instead of saying A, B, C, D, E, E, and you have to say what I'd approach them in a systematic A to E approach as part of a trauma team with da 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 da. You suddenly sound like you know what you're talking about. You haven't given any more knowledge out of there, but you suddenly sound like you're a day 1 consultant. And that is relevant because on the day you're feeling like this, you're feeling pretty dweeby. You're feeling like you don't know why on earth you're there and how you've made it, but you actually need to be feeling like this, and you need to absolutely boss it. So you need your power suit on, you need your power shoe on, you have to have the hat on that says, I am ready for this, I'm ready to be a consultant, even if you don't really feel it. But that's how you have to come across. And really the only way to do that is to practice it. And that's because the section 2 component is split over the 2 days. So you have your clinical component, which historically would have been going into hospital and examining patients. That now isn't happening and doesn't seem to be changing for the foreseeable future. So certainly I'd say for the next, or certainly for the next iteration of probably 12 months, it's still going to be that the clinical component is still in a hotel in Glasgow. So how this works is the hotel in Glasgow is set up so that the examiners are there for the whole 2 days as well as you are. When you have your clinical day, you do go and sit in front of 2 or 3 consultants and take a history from one of them, or you look at some imaging, and it is the clinical exam for you. You have long cases and short cases in both general surgery, so that includes trauma, etc., and then also in your subspecialty as well. So it's broken down over the course of the day, but essentially you'll find that you'll have multiple stations over the day with space in between them. But it is a little bit strange in that I had to break bad news of a pregnancy-associated breast cancer to an Asian gentleman in his 60s. So it is a little bit weird, and you do have to kind of just move your mindset from that. But at the same time, it's actually quite nice not having patients there, because they are a variable factor, when they sort of go off on a tangent talking about the cat. So actually, it was probably a little bit slicker, and it certainly looks like it's here to stay. The Viva aspect, so this is your second day, and it will be, in whichever order, depending on how the exam is set up. These are 4 stations altogether, and these cover your academic and basic sciences. So you have 15 minutes for academia, 15 minutes for basic sciences in the specialty of your choice. So for instance, as a breast specialist, I had the different histological and molecular subtypes of breast cancer as part of my basic science for 15 minutes, and then an academic paper, which was just, a generic paper on, I think it was an RCT on abdominal closure or something. Then you have your general surgery, then you have your subspecialty, whichever you've chosen, and then you have trauma and intensive care or critical care. So it's broken down into those different sections, and it's quite fast paced. So I've given you resources to look at kind of books for the section 2, and that does take you on a journey, from start to finish of a patient that, you've seen and done a history and examination and ended up with talking about evidence of something. For the Viva, it is a little bit more pacey than that, because you're moving between subjects really quickly. So I would say when you are starting to practice with your friends, actually you start to do that a little bit more, where you move between the subjects a little bit more promptly. A slight word of warning. So this isn't to say that this will definitely happen to you, but there is evidence out there that there are some people who may find the exam a little bit more challenging than others. There's American research from a couple of years ago, and the most recent one from the UK as well. It tries to predict trainees who might not do so well in the first round of their exam. In the American study, they looked at all of the demographic of all the trainees that were going through the American board. So it's a similar setup to us in terms of when they sit it in their residency. And if you were female and or married, you seem to have more of an issue with passing the written exam than your counterparts. And in the UK, what they found with this study, again, was looking at, I can't remember the number of years, but they looked at all of the FRCS pass rates. And although it's very good in terms of 87% of trainees passed the section 1 first time, and something like 92% passed the section 2 first time. Again, if you were female, if you were married and or had children, and if you had poorly performed in your MRCS, then you were more likely to potentially require a resit in the section 1. That was also the case of, I think, if you were over the age of 29 at graduation or something like that. So it's not to say that this is going to happen to you if you're listening and thinking, oh, that's my demographic. It's just that you might want to think about that when you're planning how you start to prepare for it. And it goes back to your third glass of wine, doesn't it? What other shit have I got going on in my life? If you've got loads of ducklings that need lots of feeding, if you've got kids, if you've got another half, if you've got someone who's got, you've got caring concerns for, these are just the things you have to think about in prepping for it. And then the final thing is, and I hope hoping that this won't matter for any of you, but if it doesn't go to plan, despite your best preparation in the world, it is a performance. So if you have failed, it doesn't mean that you were a bad trainee. It just means that your performance on that day hasn't gone the way that you wanted it to, and there might be other factors that have impacted that. So firstly, at this point, it's the only time I'll say this, now stop drinking. And because that is the vortex you don't want to fall into, and actually just realign, reset yourself, talk to lots of people if you feel that you're able to, because it's very easy to come into this vortex, especially for the section 1, where a lot of the preparation is on your own. If you then fail, you then think that you are the only person that's ever failed and you're on your own. Actually, you're not. Speak to colleagues, speak to your friends, speak to your consultants. You'll be amazed who else has failed and how did they reset themselves. Let your AES and TPD know. And if things are still going really badly, then speak to PSW through the deanery, so the professional supporting group. These are made up of counsellors, they're made up of educationists, they will go through exam prep with you, revision prep with you. There are lots and lots of resources out there if it doesn't go to plan. If you have failed and you fail by a large proportion, then in a way that's easy. It means you need to do some more work. So all you need to do then is decide, right, am I going to have a big gap or a longer gap? What am I going to do? And then if you failed by a couple of percent, which is usually what the case, it's 1 or 2%, then that's easy as well. That means it's just a performance thing on the day. You could have passed it the next day if you'd sat it in a different mind frame and you'd had a better hour's sleep. So it is nothing to do with you as a trainee. It is to do with the planning, the performance, and how it's gone on the day. So I hope that's been useful for some of you. I hope you can find some things for that, even if you feel like the exam is really far away. Actually, we should be thinking about it maybe a little bit earlier on. It'd be nice to have some more gold medals in the region, which are awarded to top marks. And we have a good outcome for that in this region. But again, we should be really kind of aiming for maximising it. And then there's lots of resources that are out there and lots of trainees that are willing to help.